Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing Viscopaste, so zinc impregnated gauze. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So Viscopaste is a 10% zinc oxide impregnated open weave gauze wrap. Okay, so the wrap is meant to go from the toes and wrap up the leg to just below the knee, about 3 fingers from the back of the knee bend. And it is preservative free. So indications for use. So we're going to be using this for chronic eczema and dermatitis where occlusion is indicated. And it may be used in conjunction with appropriate compression therapy for patients. So a lot of times I have seen this and have ordered this for venous leg ulcers. It seems to work absolutely amazing for venous leg ulcers with a compression wrap. Precautions, so you're going to discontinue if you have new redness, itchiness, or if it creates a wound. Okay, so if it's rubbing or creating a new wound, we're going to stop. And if it's also deteriorating a wound more, you're going to discontinue and get a hold of the wound clinician, nurse practitioner, or ordering physician, whoever has ordered this. So it may be used on wounds with signs and symptoms of a clinical infection as long as the infection is being treated. We can use this with compression therapy as long as we have an APBI of less than 0.8, and it's not recommended for patients with diabetes. We are going to monitor for sensation. And also if you're going to be using this with Acticoat Flex 3 or 7 for wound care, you're going to want a gauze interface just so that the paste doesn't come in contact with the Acticoat Flex. Now for most cases with wounds, we're just using this right over top of the wounds over the venous leg ulcers, and we're not putting any interface, at least in my practice. For contraindications, we're not going to be using this on clients who have a known sensitivity to zinc oxide. So we're going to start by making sure that the legs are washed or showered with warm water and then pat dry. So we're going to use a fan folding method for Viscopaste, and any paste wrap that we're going to be using. So we always start at the toes, use no tension with a 50% overlap, okay? And you can wrap the foot, heel, and ankle just in your spiral motion, ensuring that all areas are covered. Now, right when you get to the ankle, we're going to use no tension, once again, 50% overlap with each turn, and you're going to fold the bandage back on itself, okay? So say this is the leg, you're going to put the bandage to the middle and fan fold it back around to this side and fan fold it back to this side and fan fold it back to this side, back and forth all the way up the leg, just recovering itself 50% of the wrap, okay? So just keep moving up. We do that fan fold in case the patient has any swelling in their leg. So these bandages, they have no give to them whatsoever. So if their leg starts swelling, then we will actually strangulate the leg, and we don't want to cause more damage. We're trying to heal this leg, not cause any damage to it. So that's why we use the fan fold method. And now we'd go all the way up the leg to just 2 to 3 fingers below the back of the knee, okay? And then we're just going to take our gloves and smooth out the wrap, and it'll just kind of contour to the leg, and then we're either going to wrap it in cling, or if we're using a compression system, now would be the time to put on the compression system. So to remove this dressing, we're just going to simply cut it off. So you're going to stick your finger in and cut and keep doing that all the way down. Just making sure that you're not causing any damage to the skin with those scissors. That's why we're sticking our finger in and pulling up and then cutting. Now, frequency of dressing change, we want to be changing it at least once a week, or if the stocking starts to slip, it needs to be changed. And the expected outcome is that the eczema or dermatitis is resolved within 2 weeks, or if we're using it for venous leg ulcers, that you are noticing the venous leg ulcers get smaller within the 2 weeks. So that's all I have for this video on Viscopaste. I hope it does help you in your daily practice. And if you haven't done so already, if you could please hit that subscribe button, it would be greatly appreciated as it truly does help my channel. And I'll catch you guys in my next video. See ya.